I'm going to look at the shoulder girdle and lateral so that things are a little bit more visible. Camera's not in the perfect position, but this should do the trick. Now, if I'm going to assess the shoulder girdle, ideally I want to do it in a place where I can bilaterally check. This in lateral is not a place where I can bilaterally check. What we're going to assume is that I have checked the right shoulder in a position where I can get the information bilaterally and compare, and the right shoulder is the one that shows up as more restricted. So what I now want to do is identify the peak of restriction within the tissues that surround the shoulder girdle without making the assumption that based on the restriction in the macro movement that I know where it is. I might have a decent idea of where it is, but I'm not 100% sure. So I want to check the medial border, the lateral border, I want to check the pec, and ideally, I do want to check what we can call the superior border. So the easiest way to be colloquial with that or quick is the traps. So I'm going to go 1, 2, 3, 4, just to see where the peak of restriction is. The assumption is that I should be able to push into all of these tissues and they should be soft. If they are not soft, if they do not yield to my pressure, then I have identified a restriction. And then I would know where to work. My base assumption is they should all be squishy. Wherever it is not squishy, that is where I worky. Okay? So to try to show this in an ideal sense, I would want to be standing, but if I stand, you won't see. Bring your elbow up to your side. There you go. So that actually kind of puts some slack into the medial border. So the medial border is right around here. So what I'm going to do is I'm just going to squish into the medial border. All right. Now, I would want to control this in a slightly different way. There's kind of a spot here and a spot here, right? Yes. So at the inferior angle and at the superior angle, there are spots of increased tension, possibly tenderness, but I didn't ask about that. The way that I know is I squished, everything was squishy except for right at the top and right at the bottom. So I have 2 spots on the medial border. The lateral border, I'm just going to move his arm out of the way a little bit. Right, so I can pick it up here. I can put it into a mildly non-neutral position so that I can expose the lateral border. I'm going to pull and push, and then I'm going to check the tricep really quickly. So my hand goes from here, right, on the medial border. Now when I pull, you feel some resistance. Is that fair? Yes. He said yes. Okay, when I push, feels nice and squishy, right? Yes. Okay, now when I go into the tricep, when I push, it's fine. When I pull, there's something there. So there's kind of something both here and on the tricep, correct? Yes. And he said yes, which is fantastic. Now, I'm going to try to do the pec without standing up so that it's not completely obscured. But essentially, I'm going to have to get the arm away so that I have access to the tissue. I'm going to push it and pull it, right? Okay. Now, under the circumstances, you won't see this at all. If you see this, it's not the pec. The elbow's going all over the place. I need to keep the arm in the same place and the torso in the same place. Okay. When I push, it kind of wiggles. There's some tension, but it's like right up where it would attach to the bone, right? Correct. When I pull, there's resistance, correct? Correct? Okay, so there's resistance there. Now, when I check the superior border of the scapula, if you see his elbow moving all around, don't believe me. If you see his torso moving around or his head moving around, don't believe me. I've got to stop those things. Push, pull. Now, again, when I pull on the trap, it feels tight, correct? Correct. Okay, so I've actually found resistance in the soft tissue to a pressure application or a yield to pressure test. So 1, 2, 3, 4, 5, and 6. So this whole shoulder girdle could use some attention. I'm not going to necessarily dive into that, but I have the baseline assumption that everything should squish, and it should squish relatively evenly. And if it doesn't squish, that's where I work. And I found things on all borders of this right shoulder that could use some attention.